Welcome back. You're watching our continuing coverage here from Davos 2023. I'm Shireen Bhan, and joining me now is the man who heads the Gates Foundation, Mark Suzman. Mark, always a pleasure. Many thanks for joining us here in Davos. You know, the mood on how the world needs to be better prepared for the pandemic has changed. No one really seems to be talking about that anymore here in Davos. Is that a disappointment for you?
Yeah, it's a very big disappointment, and it's both a surprise and a potential tragedy, because the one thing we know, having come through the worst pandemic of the past century, which killed millions of people, caused trillions of dollars of economic damage, is we will have another one. And there have been very concrete proposals made through the G20 and other mechanisms that say for $10 billion a year, the world could put in place, through the World Health Organization, through support of regional organizations, through research and development, a system that would leave us well prepared to do that. And currently we are falling far short. It's a very depressing short-term memory.
We're falling far short of $10 billion.
Of $10 billion. The total money raised to date is $1.6 billion, which was announced at the last G20. And we need $10 billion a year, which is a fraction of the amount of money that was spent during the pandemic. So it feels to us very short-sighted.
You know, I can't even wrap my head around the fact that we haven't been able to get to the $10 billion mark, given the kind of money that is being spent on all kinds of things. But, you know, in terms of prioritization at this point in time, defense spending, and in an environment where fiscal space is getting increasingly more constrained, countries are now spending much more on defense budgets. Healthcare seems to be off the radar, not just from a pandemic point of view, but from other healthcare goal perspectives as well. How much of a setback do you foresee?
Yes, well, 2 points on that. First, on the defense side, remember that the pandemic preparedness is also preparedness against bioterror. So we do think that there actually should be some responsible use of defense resources thinking about pandemic preparedness as well. But more broadly to your question, yes, we're very concerned about setbacks in global health. COVID has been about much more than COVID. If you look at the impact across much of the global south, we've seen setbacks in areas like HIV prevention, tuberculosis, malaria, diseases that disproportionately affect those across Asia and Africa and Latin America, where for 20 years we've seen steady progress. We had seen a halving of mortality from HIV, a halving of mortality from malaria, and the last 2 years those trends have begun to reverse. They've stagnated and reversed, and that is because we're not getting the resources, we're not getting the energy and attention we need, and we think that's a serious problem that we are trying to do, and I'm spending my time at Davos here trying to get people to focus and say we need to do both and. We can focus on wars and inflation and other issues, and we can look at core human issues of health and poverty reduction.
Mm-hmm. And, you know, speaking of core human issues that need to be addressed urgently, the food crisis and food security, of course, that was, you know, front and center in the conversations when we were here in May, because I think food inflation has started to taper. It's being seen less of an issue today. But, you know, looking at the climate transition map as well, and the need for greater degree of food security, resilience as far as food supply is concerned, that's been a big focus area for the foundation as well, to try and get people to spend more on climate-resistant crop, for instance. Are you seeing more progress there?
Again, we're seeing a lot more rhetorical progress. People are saying the right things. We are not yet seeing the investment at the level and scale that's needed. So if you look at the Horn of Africa, where they are an area that has been prone to droughts historically, but they have never had 5 consecutive years missing a rainy season. And as a result, there are tens of millions of people in acute hunger at the moment, hundreds of millions of people not getting enough to eat across the continent and across some other parts of the world. And that is a direct result of climate change. And these are the people who contributed by far the least to global emissions, almost nothing. And yet they are being affected right now in real time. And we say it makes sense to put in place investments that do drought and flood resilient crops and livestock, because these are people who depend on crops and food for their lives and their livelihoods. And it's a very proven path to development. And again, it's not that expensive to do. We at the Gates Foundation, we made a commitment of $1.4 billion into climate adaptation at the recent COP conference. This is going to be a top priority for us. But again, while people say the right things, we are not seeing investments and resources coming in at close to the scale it is needed.
You know, speaking of investments and talking about collaboration as well, here the theme at the World Economic Forum is the risks associated with an increasingly fragmented world. And I'll ask you this in the context of what we saw happen more than 2 decades ago. Gavi, the Vaccine Alliance, was born here in Davos. Are you hopeful that between governments and the private sector, we are going to be able to come together, come up with alliances like Gavi to be able to address some of these issues that we just spoke of?
Yes. Well, 20 years ago, 2 great organizations were born, and the Gates Foundation was proud to have a part in creating both of them. Gavi, the Vaccine Alliance, and the Global Fund to Fight AIDS, TB, and Malaria. And between them, those have been arguably the most successful global health interventions in human history. They've saved literally millions of lives, children from preventable deaths from vaccines, adults from preventable deaths from HIV and also malaria. And so those models, those are public-private partnerships where governments came together. We work with the private sector to help drive down the costs and provide innovative products, work with southern governments to make sure we have distribution and supply chain networks that reach people. Those are the models we know that work. And those are the models we need to rebuild now. Those are the models we need for pandemic preparedness. Those are the models we need to show exciting new tools we have in digital financial inclusion, in climate adaptation.
Is there any appetite for building that kind of collaboration, cooperation at this point?
Well, people talk about it as something that would be good to do. We haven't seen the kind of galvanized action, but we have some hopes. There are some leaders looking around these issues. I know with India coming in as the host of this year's G20 has an ambitious agenda that covers some of these issues, from medical countermeasures to digital financial inclusion and women's economic empowerment broadly, and gender equality. And so what we need are some of these galvanizing moments and some ideas and coalitions and partnerships. So I'm caught between optimism and pessimism. I say we haven't seen the action to date that we've needed, but we've got the ingredients, we've got the tools, we have the innovations, we have the potential partners. What we need is the political will and energy to put it all together.
Well, yes, somewhere in the middle between hope and pessimism. But let's talk about India. You brought up the G20, and of course, healthcare is going to be part of the G20 agenda for India as well. The priorities for the foundation in India, the partnerships that you hope to nurture going forward?
Yes, well, we've been in India for close to 2 decades now, and have a set of very close partnerships both at state and national level, and with a range of private and civil society partners. So some of our most exciting work has been working in the states of Bihar and Uttar Pradesh, supporting the governments and the chief ministers there around an array of particularly health and agriculture interventions. We've also been working with groups like the Department of Biotechnology around helping support where India has a lot of research and development innovation going on in areas like crops and livestock and some of the medical areas. And we also work closely with partners like the Serum Institute of India and other companies who have developed life-saving vaccines, are the largest suppliers actually to the Gavi Vaccine Alliance, and also trying to look and learn from some of the models. We talked about digital financial inclusion, and I think, and digital identity. These are fundamental building blocks for development, where India, between the Aadhaar and the UPI system, and also innovations such as the Covan vaccine system, are models that we think can be expanded and built out in many other countries to benefit. And so we're constantly looking for ways to both help support the government with its own priorities to drive that agenda forward, and seeing when there are exciting innovations that we've been learning from in India that we can help bring to other countries as well.
Mark, let me ask you this, and I think you addressed this in your annual letter that you put out here in Davos. It's been a challenging 2 years for the foundation through the course of the pandemic. Of course, there are the absurd theories that Bill Gates is tracking you and there's a chip in the vaccine and so on and so forth. But there have been many questions asked about why you get to decide what strategies a government should follow when it comes to immunization, or the healthcare choices and healthcare imperatives that a government decides to put in place. You've responded to some of that as well. You're not elected representatives. Why do you get to have a seat at the table?
Well, there are 2 different issues of things. One is, what are our goals? Our goal is a very simple goal. Our mission, which is carved on our building in Seattle, is that every person deserves the chance to a healthy and productive life. and we look for areas where we see massive inequities. Those are in areas like health, in poverty, in financial access. And there we respond not to our agenda, it's an agenda set by the world. The Sustainable Development Goals were adopted in 2015 by every single member state, and they are commitments to their own citizens. We then work in those areas, whether it's about malaria, reducing child mortality, whether it's gender equality and women's empowerment, all of those are global goals. And then what we will do, as we do in India, is we work very closely with the government and say, how are you prioritizing these? Where can our expertise potentially be helpful or not? And so in everything, it's always with partnership with stakeholders, in full dialogue. So, the seat at the table is a seat we need to be asked to take. We don't force our way into anything.
Mark Sussman, it's always a pleasure. Appreciate you joining us here in Davos on CNBC TV 18. Thanks very much for your time.
Great. Thank you so much.
Well, we are going to take a break, but the conversations will continue. Stay with us. You're watching Davos 2023. We're back in a moment with more.